Let me start this. Hello, Avids. A very good morning again. It's a Monday morning. I hope this will be a very good week to you people. Let me start this webinar with some of the selected questions from the last week, that is on iSlim. So the first query is, I've just tried to list out some of the queries here, so I'll just take the major ones. The first query is from Mr. Sajan Kumar Moharana, who is one of our distributors. He asks me that what is a tentative figure that the distributors can give for the weight loss that can happen with iSlim? So probably in a frequency of 3 months. See, what I will answer you is, see, first of all, there is a very well designated, a very well designed diet chart for iSlim already. I think you must all be knowing about this by now. So this iSlim diet chart is scientifically made, in the sense when a person is actually losing the weight, he should not consume more of carbohydrate and starch. So in fact, when you look into the diet chart of iSlim, the amount of carbohydrates and starch are very minimal, whereas there is moderate amount of proteins which are present inside the diet chart. So this is what is exactly designed in the iSlim diet chart. So as far as your question is concerned, well, what I will tell you is, if a person takes iSlim, and one more thing, before going into this, I want to again explain you this particular thing. When a person's weight is above 80 kgs, above 80 kilograms, I normally suggest the people to use 1 sachet of iSlim in the morning, that is skipping the breakfast, and 1 sachet of iSlim in the night without skipping the dinner. In fact, the dinner should be a light dinner. You should never skip dinner actually. It should be a light dinner. So the next important thing is, when you follow this diet chart and consume iSlim in a proper way, so probably what I can give you a figure is, this is what I have noted actually. Around India, when people consume iSlim, I have noted this particular figure. After you follow this diet chart, probably there is a reduction of 3 to 5 kgs of weight in 1 month. That's what I can probably tell you when the diet chart is properly followed. That's what it is. See, and the major mantra here is, suppose if a person is reducing weight, suppose if you are a non-vegetarian, you should not leave non-vegetarian, but there are certain components of non-vegetarian that you have to leave. If you look into the diet chart, those components have been clearly listed there. I again suggest you to go through the diet chart once. And the other important thing is, so this particular diet chart, again I am emphasizing this point, the carbohydrate and the starch content in your diet has to be lower always, and there should be moderate protein content in your diet. That is this is a major mantra for reducing the weight, and in fact the diet chart of iSlim has this particular mantra. So what I suggest Mr. Sajan Kumar Moharana is, probably if a person follows this diet chart properly, definitely there will be a reduction of weight in a range of 3 to 5 kgs in 1 month. So probably in 3 months, definitely you can calculate. So this is what the answer for your question is. So this is what the FAQs are. So I hope I have answered your question. Thank you. So hello Avids. So we'll start with the webinar of iCoffee today. I hope most of you are awaiting this, because I've got some of the messages on the FAQ page that people are waiting for this. Thank you very much for that. Well, to start with iCoffee, well, I always told the ranking system of diseases in the world. Even last time I told, India is actually 3rd rank in obesity, followed by US and China. Whereas when it comes to diabetes, India is actually called the diabetes capital of the world. We are 1 in diabetes, which means to say we are number 1 in diabetes. Suppose if a student scores first rank in their intermediate or in degree or post graduation or PhD, it's a very good thing. Suppose if we are scoring rank 1 in a disease like diabetes, it is very, very bad. But again, the positive part is now we have got the opportunity to tackle this diabetes, and of course it is with iCoffee. So that's a very good opportunity which is provided by IndusViva. Well, I'd like to start this webinar on diabetics by saying some of the practical things that I've noted in my clinical practice. See, majority of the patients who come to me with history of diabetes or even diagnosis of diabetes recently, they ask me one thing: is diabetes curable? That is a major question. See, the answer for this question is quite difficult actually. Diabetes is a disease which is not 100% curable. See, there are some of the thoughts, some of the, there are so many such versions of answers that you find on the website these days. Diabetes is 100% not curable, but in medical terms, we call this as a palliative disease. I'd like to repeat this. This is called as a palliative disease. Palliative in the sense, it is controllable. It can be preventable. So, it is controllable and preventable. So, it is called as palliative disease. So, I normally tell my patients that diabetes can be controlled definitely. That's what. So, what they can do is they have to follow the diet also. Diet also plays a very important part in diabetes. So, along with the diet and proper precautionary measures, definitely diabetes can be managed, it can be prevented, definitely it can be controlled. But as far as I know, and most of the scientific papers do say, there is 100% cure for diabetes is not available throughout the world. Well, diabetes is actually a disorder. So, I'd like to start with this point. See, disease is actually a single entity, whereas when it comes to disorder, it is a combination of various diseases. When you look into a condition like diabetes, diabetes is actually a disorder with nearly 10 or 12 major such conditions affecting the human body. They are otherwise called as the complications of diabetes. In fact, a person who is suffering from diabetes will certainly have these complications. These complications are otherwise called as the symptoms of diabetes, and in fact, to control these complications is the major aim and objective of iCoffee. So, rather than curing diabetes 100%, we are trying to prevent it, we are trying to control it, we are trying to manage it with iCoffee. So, please have these three mantras in your brain when you are trying to distribute iCoffee. So, the next important thing is the three important factors which affect diabetes are mainly genetic. Definitely genetics plays a very important role. See, family history of diabetes plays an important role in the manifestation of this disease. See, in colloquial terms, what we call diabetes is a sugar disease. So, normally people call, okay, we have sugar, the patient has sugar. In fact, this is or impaired glycemic control. Genetics is the first and the foremost thing. Even though there are some schools of thought which says that genetics and family history, group of people saying that genetics still plays a very important role in the manifestation of diabetes. Definitely that is there, but the demography, when you see these days in this particular century or era, because of the intake of these processed western foods, which are mainly containing more amount of fat and proteins, large amount of proteins, people can have this particular diabetes mellitus without any family history also. That's what I want to emphasize here. Family history does have a part in the manifestation of diabetes, but sometimes even without family history also people are affected with diabetes even in young age, which I am going to tell you in further things, which is nothing but the gestational diabetes or type 1 diabetes, which is really haunting Indian population these days. Well, the second thing is environmental causes are also there. Like, that's what the dietary habits also play a very important role in the manifestation of diabetes. See, excess intake of these processed sugars. In fact, the sucrose, always I tell people about the glycemic index part, which I am going to repeat it right now. See, there are several sugars present in this world. The normal sugar that we eat in our houses come from sugar cane. It is called as cane sugar or sucrose. In fact, sucrose has a glycemic index of around 75. So, that is actually the glycemic index of sucrose. Whereas, when you see the other sugars, the glycemic indices are pretty low than that of glucose. That is the actual reason why the sucrose is in fact the major, the causative factor or the etiological factor. So if you don't sleep properly in the nights also because of excessive stress and such other things, definitely one can be prone to this particular diabetes mellitus. Well, I'd like to tell you some important ranges and values so far as the diabetes is concerned. See, when a person's sugar level, that is especially the fasting sugar levels, probably please make a note of this if you want to. When the fasting sugar levels are more than 126 and the postprandial sugar levels in the sense the sugar levels after taking the food are more than 200. So I'd like to repeat it again. When the fasting blood sugars are more than 126 and if the postprandial blood sugar levels are more than 200, a person is known to be diabetic. So this is actually the initial stage or the diagnostic criteria for the diabetes mellitus. The second important thing is pre-diabetes. This is one of the major haunting conditions which is prevailing in India today, is a condition of pre-diabetes. See, pre-diabetes is actually affecting young adults. I'd like to tell you the age group. It is between 25 to 40 years of age, pre-diabetes is affecting the people. When the blood sugar levels are between 100 and 125, that is 100 for fasting and 125 for postprandial. So in the sense 100 and 125 for fasting, 140 to 199 for postprandial. I'd like to repeat this again. When the person's fasting blood glucose levels are ranging between 100 to 125 and the postprandial blood sugar levels are ranging between 140 to 199 constantly for a period of 1 year or so, and if the person's age group is 25 to 40 years, he or she is known to be pre-diabetic. In fact, see, pre-diabetes is a condition which can turn into type 2 diabetes after 40 years of age. I'd like to tell you distributors, I also suggest you to give the Sai coffee to such people of pre-diabetes. See, that's a very important segment these days. Eye coffee is not only a thing which can be given to a person who is suffering from type 2 diabetes. It can be definitely given to a person with pre-diabetic ranging from 25 to 40 years of age. It's very, very important. See, there are three major symptoms of diabetes that everybody has to know. See, those three symptoms are called as 3 P's. P's, P for parrot. So, those three symptoms include, the first thing is polyuria. P for polyuria. Polyuria is increased urination. Polyphagia, the second one, which is increased hunger, and the third one is polydipsia or increased thirst. So increased urination, increased hunger and increased thirst. These are the 3 P's of diabetes. So whenever a person is having these 3 P's of diabetes, definitely he is going into the condition of impaired sugar levels. See, there are, again, coming to the types of diabetes, what I can tell you is there are 3 types of diabetes. The first thing is type 1 diabetes. Type 1 is also called as insulin dependent diabetes mellitus, or we also call it as IDDM. The second one is called as non-insulin dependent diabetes mellitus, or NIDDM, and the third one is called as gestational diabetes, which normally happens during the pregnancy. Normally this gestational diabetes after pregnancy it ceases, but sometimes what happens, because of the impaired sugar levels, a pregnant woman after delivery can be diabetic throughout her life. This can also happen. And the fourth important type of diabetes, what I've already explained to you, is pre-diabetes. Pre-diabetes is actually not included in the classification of diabetes, but still it is a very, very important disease, which is disorder which is prevailing in this country right now. Well, so the next, coming to the medications of diabetes. See, most of you might be diabetic, or most of the people in your family may be suffering from diabetes. See, whenever a person is diagnosed with diabetes, normally they go to a doctor and get their blood tested, and ultimately the doctor diagnoses the patient to be diabetic and starts the medications. See, there is the advantage part of it as well as the disadvantage part of the medications also. Let me talk to you about the disadvantages first. So normally the people start with Dianyl. Again, they try to experiment with other biguanides which are available, like the glibenclamide or the metformin, the combination of glibenclamide and metformin, and ultimately they go for insulin. Insulin is actually a human hormone which is secreted. So these medications, even though side effects on the kidneys, that is a major thing. Kidneys will be affected with this diabetes always. See, kidneys, the impairment of kidneys can also happen with diabetes. So the excretion of the urine as well as the functioning of the kidneys will reduce with this diabetes. So and ultimately most of these synthetic medications will affect the kidneys in a long run. And to also tell you, see, there is one more statistics. A person who is diagnosed with diabetes in a span of 10 years will definitely develop kidney disease. That is why in the field also I am seeing right now, most of the people with diabetes mellitus, after a period of 10 years, they are even under dialysis, because both the kidney failure will happen and ultimately they have to depend on the dialysis most of the times. Well, so the next thing is a small, this one about the statistics about the diabetes. See, diabetes is actually a global problem these days. See, I'll talk to you about the Indian scenario. See, today in India, when you see, this is the diabetes. This is a very damaging figure, and of course it's again an advantage, because it's an opportunity for us to distribute this iSlim and to suggest this iCoffee, suggest this iCoffee, so that definitely this 150% increase in diabetes can be prevented, it can be managed, it can be controlled. Well, so coming to this diabetes complications, I always say this particular point wherever I go. Diabetes is a disorder, it is not a disease. So, a disorder is comprising many such symptoms. Let me talk to you about some of the symptoms of diabetes, or in other words, they are called as the complications of diabetes. So, the first thing is the person always gets tired. Everybody gets tired actually. It's a routine thing. If you are working hard every day, definitely you will get tired. But when a person without any reason is feeling tired even after eating properly and drinking properly, that is the first and the foremost symptom of diabetes, always getting tired. The second thing is frequent urination. I have already told you, it is called as polyuria, the first P. When a person passes urine at least for 7 to 10 times in a day and at least for 3 times in the night, I would like to repeat it again, 7 to 10 times during the day times and of course up to 3 times in the night, it's called as increased urination or polyuria. See, normally during the winter seasons, everybody of us pass urine. Everybody of us probably can pass about 6 to 7 times. It is normal. But even during summer seasons, without the intake of water, if a person is urinating at least for 7 to 10 times during the daytime and more than 3 times in the night, definitely it's a very major symptom of diabetes. The next thing is sudden loss of weight. Normally patients come and tell me, sir, I was around 60 kg, sir. Of iCoffee. The next affect the diabetes people very badly. Next thing is blurry vision. Definitely, this is called as diabetic retinopathy. So when there is impairment in the sugar levels, especially in the eyes, the retinas get damaged. See, retina is one such organ in the body. When it is damaged, you cannot replace back the retina. It is permanent damage. In order to prevent this permanent damage, definitely you have to use eye coffee. So that is called as diabetic retinopathy. Next thing is vaginal infections. Especially in ladies, female patients, normally this vaginal infections like leukorrhea or white discharge, itching around the vagina, or sometimes even dyspareunia or sexual pain. Pain during sexual intercourse can also happen. All these things can happen because of impairment in the sugar levels, and the pH in the vagina changes because of all these sugar impairments. That is called as vaginal infections. The next thing is numbness or tingling in the feet. This is the first thing that the people tell you. Most of you might be knowing it. There is burning sensation in my feet. There is pricks and needles. There is something like a needle which is pricking my leg, pricking my feet. That is also a major symptom of diabetes. This is actually called as diabetic neuropathy. Diabetic neuropathy is the nerves which are present inside the legs, they actually lose their function, or sometimes they will hyperfunction. They will function more. Both of the things can happen. That will result in neuralgic pains. Normally people with diabetes will have lots of this leg pain will be there, the low back pain will be there. All such things can happen. Such things can be definitely prevented with eye coffee. And the next important thing is kidney disease. As I have already told you, normally what happens is a person who is said to be diabetic, after 10 years gap, normally they are sure for developing this kidney disease. Definitely they will go in for dialysis also later on, and this is called as diabetic nephropathy. So there are three pathies of diabetic. One is diabetic retinopathy, the second is diabetic neuropathy, and the third is diabetic nephropathy. So retinopathy is affecting the eyes, neuropathy is affecting the legs, which is the nerves, and the nephropathy is affecting the kidneys. So please remember these three pathies when you are talking to people in the field. Well, the next important thing is, I've already told you about the pre-diabetes, so please try to concentrate on this pre-diabetic segment also, especially the people who are suffering between 25 to 40 years of age in the sugar levels that I have mentioned before. Try to give them eye coffee so that they can be prevented of this type 2 diabetes in future, which is a very important thing that you people are doing actually. So trying to prevent those people from entering into type 2 diabetes. Well, the next important thing is, coming back to this eye coffee now, the major active constituent or the herbal ingredient which is present inside eye coffee is called as salsitol. Salsitol, as the name indicates, it contains a herbal active called as Salacia reticulata. See, Salacia reticulata, I have already told you in eye slim also. This is actually called as Ekanayakam. See, Ekanayakam is actually a shrub. It is not even a big tree or a small plant, it is a shrub. Shrub is a medium sized tree which is growing in some coastal parts of India, especially from Maharashtra till the end of Kerala. This particular plant is explained in the textbooks of Ayurveda for its potential in diabetes, especially for the management of diabetes. Salsitol is actually a unique blend which is which is very sophisticated extract which is actually made by various phytochemical methods. The extraction has been done and the extract has been used in this particular product. Salsitol in fact has a particular phytoconstituent called as salacinol. Salacinol is actually the anti-diabetic constituent which is present in eye coffee. In fact, in order not to compromise the taste of coffee, this salacinol or the salsitol is actually added with the actual coffee beans which is present from which is organically plucked, which is actually present in our state of Karnataka. So this is actually about the salsitol. So in fact, this salsitol is a very good herb for pre-diabetes, type 1 as well as type 2 diabetes. And the other important thing what I am going to tell you right now is salsitol can be safely used in pregnancy also, because in fact Ekanayakam has been used in the textbook of Ayurveda. We find the references that this has been used in pregnant women as well. So in fact, I have been telling this most of the times, try to see the trimesters first. Always it is safe to use the product within first to 6 months, that is the first and the second trimester, but during the third trimester it is always under observation that one needs to use the product. It can definitely be used, but under observation always. Well, so coming back to this salsitol now, salsitol is actually a carbohydrate blocker. See, normally when the excess of carbohydrate is present inside the body. Carbohydrates mainly include the sugars as well as the starch. Well, so probably when you take white rice for example, it contains more sugar and more starch. Whenever you consume more sugar and more starch, the absorption does not happen in the body. Whereas this salsitol is a very good carbohydrate blocker. It actually inhibits excessive carbohydrates and therefore it prevents diabetes mellitus. In fact, to tell you more about salsitol actually acts in two ways. One is it has activity on pancreas, which is a very important organ in the regulation of sugar. Second thing is it has the activity on small intestines. Small intestine is a part where absorption of sugar normally happens. So I'd like to repeat this again. Salsitol acts on two important organs in the body. One is pancreas, the second is small intestine. So both of the organs are related to the regulation of sugar. So salsitol regulates the sugar by acting on the small intestines and pancreas. In fact, to know more about the salsitol, probably you might be knowing it is on the pack of the iCoffee itself. There are several clinical trial reports which are present in the clinical trial registry of Government of India, as well as some of the documents in the ICMR, the Indian Council of Medical Research. So I'll also try to quote one small pre-diabetic trial which has happened on the salsitol. It is also documented in the clinical trial registry of Government of India. So pre-diabetic patients were actually given salsitol for 6 weeks, and after 6 weeks it was seen that the fasting blood sugars as well as the LDL cholesterol in the sense it is bad fat which is present in the body, it reduced drastically. So in the matter of 6 weeks, the salsitol reduced the bad sugars as well as the bad cholesterol in the body, and especially that was a trial which was registered in the clinical trial registry of Government of India. So especially this trial was done in pre-diabetic patients. That is why I am again trying to emphasize that iCoffee can also be given in pre-diabetic subjects. I am trying to repeat this again. 25 to 40 years of age is actually called as pre-diabetic subjects. Try to give them the iCoffee and definitely the results will be there. Well, I'd like to give you some FAQs of iCoffee right now. What patients regularly ask me: suitable for all types of diabetes? Definitely yes. iCoffee is very much suitable for type 1 diabetes. A small explanation of type 1. Type 1 is seen majority in children and also in some of the adults. Type 1 diabetes is also called as insulin dependent diabetes mellitus, where the pancreas totally failed to produce insulin. Even in such conditions, definitely iCoffee can be given, but certain dose modulations have to be made while giving it to children. Definitely it can be given in type 2 diabetes as well as gestational diabetes also. The second important query what people ask me is, does iCoffee contain sugar? Well, iCoffee does not have sugar. I am telling you this because there is a component called as milk creamer which is present in iCoffee. This milk creamer actually contains a sugar called as lactose. It is not sucrose, it is lactose. Lactose, the glycemic index of this particular lactose is very, very much low than that of sugar. Definitely this can be used in all kinds of diabetes patients. This will not cause impairment of sugar. So again I am repeating this, iCoffee will not cause impairment of sugars because it does not contain sugar or sucrose, but it contains lactose or milk sugar, which does not impair the sugars inside the body. Well, how long should this be taken? This is one thing what people ask me. Well, as long as you desire, iCoffee can be taken, but again it depends on the condition. Well, can a normal person use iCoffee is other question that the people ask. Well, normal people can definitely use iCoffee, but when you are using this iCoffee, what I try to tell them is, suppose if you don't have sugar, you don't have a family history of sugar or any signs and symptoms of sugar, you can definitely have iCoffee, but try to add a bit of sugar if you want to the iCoffee, prepare it and drink it. Definitely there will be no problems. But sometimes people do have some perception that people who do not have sugar, if they consume iCoffee, that can lead to lowering of the sugar and they can fall unconscious or giddiness can happen. That can sometimes it can happen. That is the reason why I am trying to tell that add a bit of sugar to iCoffee and drink if you are a normal person. Definitely that will not cause any problems. Well, can this iCoffee be taken with other medications? Definitely. So normally the diabetic people will have other medications with them. Our product is a supplement. Our product is a preventive product. It can be taken along with other medications also. Normally the diabetic people will be taking the combination of drugs like the glibenclamide or the metformin or the Dianyl, such products, definitely eye coffee can be given along with those medications. So there will be no problems, as this is a 100% natural product and it will not cause any side effects. Second thing, insulin. Suppose if the person is on insulin, can we give eye coffee, is another question that the people ask. Well, definitely when the person is on insulin, you can definitely give eye coffee, but again it depends upon the units of insulin. I am trying to emphasize this again, it depends on the units of insulin. Suppose if a person is using 40 units of insulin or above in a day, 40 or above in a day, for such patients it is always better to give one sachet of eye coffee in a day. I am telling you this because insulin is actually a very major sugar modulator. Along with this, suppose if you are giving 2 or 3 sachets of eye coffee, there is always a problem of sugar lowering immediately. So for people with insulin above 40 units, I always suggest 1 sachet of eye coffee to be given. Whereas people who are using 40 units and below 40 units, if someone is using, definitely you can give 2 sachets of eye coffee in a day. That will not cause any problems. This is a small sutra, a small mantra I am trying to tell you. That's it. So, can this eye coffee lower the sugar immediately, is another question that the people ask me. Normally what happens, diabetic people normally know this. Suppose if they don't take the tablet in the morning, they will have some real problems in their life. Suppose if they take the tablet in the morning, if they don't eat properly, it will cause real hell in their life every day. These people actually know it. See, what exactly happens is, normally when you eat something and then you take the sugar tablets, the sugar level lowering will happen. Sometimes it is, it lowers to the extent of 30 to 40. In the sense, the person will go into a state of hypoglycemic shock. It is actually called as hypoglycemic shock and the person has to be hospitalized. Whereas our product eye coffee is just a supplement. It is definitely a supplement which will not lower the sugar immediately. It will definitely lower the sugar gradually but not immediately. So you should not have any fear that the eye coffee will reduce the sugar immediately. Definitely it will lower the sugar but very gradually. Well, with this I would like to come to the end of this particular webinar. Before ending this, I would like to tell you the dose of eye coffee once. So because this is one such query that the people ask me. What should be the dose of eye coffee or how much water has to be? In the sense, you can heat the water, mix eye coffee along with it, then cool it a bit and then drink it, there is no problem. But you should always mix this with hot water. Always such beverages like coffee and tea, bring all the herbal actives inside. Normally it requires high temperature of water to bring all the herbal actives inside. So for eye coffee also, what I am suggesting you is use hot water, 100 to 120 ml of hot water and 15 grams of, that is 1 sachet of eye coffee to be mixed with that, can be taken 2 times in a day. That is once in the morning and once in the night. Always preferably what I suggest you is take this before food. Half an hour before food should always be the suggested dose to the consumers as well. So suppose if this is taken after food, what will happen is another question that the people ask me. Well, suppose in a normal person who is not diagnosed with diabetes, who is otherwise not having sugar, definitely this can be given after food. See, but for people with diabetes or pre-diabetes or conditions of diabetes, better to be given before food, because most of the anti-diabetic products will be absorbed very nicely before food only. The absorption is a very important phase in any of the products actually. The product to be absorbed inside the body, it should always be taken before food. So all anti-diabetic products, it is always advised to take before food. So I always suggest eye coffee to be taken half an hour before food. So with this, I would like to end the webinar on this eye coffee. Well, so if you have any queries, you can shoot me your queries on the FAQ page of IndusViva Health Sciences website, at the Facebook page, or you can also shoot me your queries on the WhatsApp number that is provided. Well, with this, distributors, I would like to end this webinar on eye coffee. Thank you very much. So this is Dr. Balu Kolar signing off from the desk. Thank you.